We're discussing about a research project that we'll be presenting today. It's called Multidisciplinary Sepsis and Shock Response Team, how quality improvement interventions improve metrics and outcomes in patients with sepsis that present to the emergency department. We essentially track all septic patients that came to our institution for a year, and we ended up including 424 patients in this particular study that we're presenting today. The basis of the study is that in 2013, the Surviving Sepsis campaign guidelines were published in their last version, and we wanted to see how those guidelines were or not being transmitted directly into the practice. We essentially did a baseline metric at the beginning of 2013, and we found a big gap between the current practice and what the guidelines were saying. You know, sepsis is one of the most important diseases nationwide and worldwide in terms of mortality. And the second, piece of that is that there's a significant amount of health care cost dollars that go into treating sepsis, and particularly at our institution, sepsis was the number one DRG with the worst performing numbers. It means that most likely the patients coming to the emergency room, particularly in our institution, were not receiving the quote-unquote standard of care based on those guidelines. I think most likely it's how difficult it is to change the culture at any institution and in any department. And particularly when you get a set of guidelines, it takes probably several years for people to catch up with them, not only in the knowledge level, because they may learn that as they read them, but to actually put them into practice. The guidelines were very clear on intervening early, and that concept we tend to have. But the guidelines were also very clear on how to do more aggressive interventions at the beginning, and that's where exactly the gap was. People knew about these interventions, but they wouldn't come into much later into that patient's hospital stay. Unfortunately, it hasn't been until recently, in October of this year, that CMS is starting to look at the metrics. So back in 2013, when we did this, at the institutional level, there was the quality office that may be looking at some of these metrics. Mayo Clinic reports data to the University Healthcare Consortium, and they tend to look at how these patients do, but not necessarily at those metrics. So really, nobody from the practice itself had been focusing on the compliance with their resuscitation metrics.